Hello, everyone. We are Team 48, and today we'll be talking about our plan, Bishash Banano Por Bashan Korano, building trust, creating distribution, in order to combat vaccine hesitancy and promote equitable distribution of the COVID-19 vaccine in Bangladesh. Before we get into depth about our plan, we must first establish the current COVID-19 situation in Bangladesh. Bangladesh, a country of over 160 million people, has reported over 560,000 cases of COVID 19 since the outbreak began last year. Of these thousands of cases, 2,000 cases reported in the last 24 hours. This number aligns with the recent spike in cases that is causing alarm in the nation, with the start of a new infection wave, as evidenced on the graph to the right. I'll hand it over to Sai to highlight what our plan entails.
Thank you, Futsum. As the Ministry of Health and Family Welfare, we are focused on rapidly increasing the vaccination capacity as well as uptake to protect the Bangladeshi population from this virus. We will achieve this goal by tackling two key issues: vaccine hesitancy and inequity in distribution. We will directly address vaccine hesitancy that stems from religious concerns, misinformation, a distrust in the origins of the vaccine, and a growing apathy to the COVID 19 pandemic. To ensure an equitable distribution of the vaccine, we will prioritize vulnerable and disadvantaged populations such as factory workers, slum residents, and the rural population, along with, of course, healthcare workers. Our proposal seeks to utilize existing networks and infrastructure in Bangladesh while bolstering them to ensure rapid deployment. To combat vaccine hesitancy, we will work to build community trust by directly engaging with community and religious leaders at the local as well as national levels to promote vaccination. Second, we will create a mass media campaign that promotes awareness of the benefits as well as the necessity of vaccination. Simultaneously, we will increase vaccine accessibility by bringing vaccines to vulnerable populations via mobile vaccination units and on site vaccinations at the workplace, especially for garment factory workers. On the topic of vaccine perception, Bangladesh has had a history of successful vaccination campaigns, be it with tuberculosis or polio. As a result, the general acceptance of vaccines is not as bad as it is in some Western nations. However, with regards to COVID 19, thanks to the spread of misinformation, many fear that the vaccines are not halal, and not all religious leaders have come out in support of the vaccine yet. Complicating this is an increasing apathy towards COVID 19 as it is seen as a disease that primarily affects the elderly. Furthermore, many low wage workers, COVID 19 has unfortunately been far from their biggest problem as they continue to have to go out and work so as to not starve so as to continue to provide for their family. Addressing all aspects of this hesitancy proactively is the need of the hour, and I will hand it over to Anindita now, who will explain how we will do this.
Thanks, Sai. Combating hesitancy requires building trust. For this, we will partner with Building Resources Across Communities, BRAC, a trusted NGO that employs local residents as community health workers across Bangladesh. Utilizing their Jikasha model, they will promote open dialogue with rural residents, providing accurate information and answering resident questions about the COVID-19 vaccine. This will help dispel misinformation within communities. Also, as almost 90% of Bangladesh's population is Muslim, we will partner with the Islamic Foundation of Bangladesh to train these imams to provide post-service reminders about vaccine registration and to reassure people that the vaccine is in line with religion. Strategic widespread messaging will also be tailored towards family and youth populations. Bangladeshis are family-oriented, with decisions traditionally made by elders and patriarchs. Accordingly, we will tie messaging to these values that appeal to entire family units, especially elders. Since 26% of the population is illiterate, our messaging will be heavily visual and oral-based. In addition to posters, we will also have media messaging created by Bangladeshi communications NGOs, and these will be distributed through local and national TV and radio. To target youth, we will utilize cricket, which is one of the most popular sports in Bangladesh. We will collaborate with the Bangladesh national cricket team to counter COVID-19 apathy and promote vaccine attitudes among the youth. In collaboration with the Ministry of Cultural Affairs, we will also sponsor vaccine-themed state art competitions for the youth. This will encourage students to research and tailor COVID-19 messaging to their communities and also increase their disease knowledge and youth engagement in the process. Now, I will turn it over to Lynette to talk about our distribution plan.
Thanks, Anindita. Our team has identified factory workers, slum residents, and rural villagers to be vulnerable groups of interest for the vaccine. Garment factory workers are low-wage workers and can't risk missing work. Since the garment industry represents 80% of Bangladesh's export income, it is imperative that the factory workers' health is secured as they are vital to the economy. Slum residents number 4 million in Dhaka city alone. Since slums have high population densities, social distancing can't feasibly occur, leading to continued disease transmission. Lastly, rural villagers make up over 60% of Bangladesh's population. However, many hospitals and clinics are located in urban areas, making these facilities and vaccination harder to access. To aid factory workers, we'll administer vaccines on site within their clinics. Funding will go towards upgrading the clinics with vaccination equipment. The company Base IT will create an information system that will connect Bangladesh's biometric database with our vaccination database. This way, workers can be rapidly registered through fingerprinting and administer the vaccine. Base IT will also create an SMS bot that provides post-vaccination care instructions to workers via SMS text. As an incentive for receiving the vaccine, workers will also be provided rice and dal rations by the World Food Program. Mobile clinics will address transportation barriers. Rural clinic vans can transport more vaccines and require less refills. Some clinic vans will be smaller and can navigate narrow streets. The World Health Organization, Bangladesh Medical Association, and various local implementing partners will secure and staff the clinics. Base IT's vaccination management system will allow canvassers to track which areas they have already covered. Now on to Ellen to talk about health systems enhancement.
Thanks, Lynette. Working off community clinic models is key to our plan's success. Preliminary research has shown that these are effective methods to increase harmony. Implementing partners such as the Bangladesh Private Medical College Association and the WHO will help us fit into the existing clinic networks by providing trainings. Additionally, our approach is built up the Johnson & Johnson vaccine utilization. This formula not only transports well within fridge temperature, but it's also one dose, so it can speed up the full immunization process. If 2 doses are to use, considering that monsoon season will displace many residents, it will be hard for us to keep track that both doses are being used for each resident. Lastly, the Johnson & Johnson vaccine is used in countries such as US, which can give people extra confidence. Talking about timeline, speed is always the key within this pandemic. As such, many of our actions, as you can see, will run in parallel in the first 2 months, such as launching the vaccine campaigns, training new workers, and setting up vaccination sites. This expedited process will allow us to start vaccinate distribution as soon as possible based on the population we prioritized, so we can get as many people as possible to get vaccinated within a short period of time. Additionally, periodic survey team will take a key role in our monitoring process, which will build a feedback loop from the vaccination experience and allow us to adjust our approach based on people's needs. Now I'll pass it on to Shifali to talk about our budget.
Thank you, Ellen. Our $81 million budget reflects our primary goals. For vaccine hesitancy, we are actively fighting misinformation through specialized media and PR campaigns, along with measures for increased grassroots community trust. For equitable distribution, we are serving vulnerable populations by tailoring logistics to help meet rural, slum, and factory worker populations where they are through mobile vaccination units and on-site vaccination. Our M&D plan focuses on increasing trust and vaccination willingness, as well as decreasing access barriers. To assess these, the Bangladesh Center for Communications Programs will put out bi-monthly surveys, both in person and digitally, measuring perceptions on vaccine safety and efficacy. The results will help us modify our program to better suit the community's needs. We ultimately aim to bring national vaccination rates to above 40% at the end of the year, and at 80% within the targeted communities. Thank you so much for listening. We look forward to your questions.